Terrific. Okay, welcome everybody. My name's Eddie Bartnick. I'm chair of the Sponsoring Countries Leadership Group for IIDL, and as host for this session, I want to warmly welcome all of our members of the Sponsoring Countries Leadership Group for IIDL, and also our guests from IIMHL as well. And so this meeting's for the US, Europe, and the UK. It's our second session. We had a wonderful session yesterday evening US time with our colleagues in Canada, Australia, New Zealand as well, and that went terrifically well, and I've been really can't wait to hear our speakers again. I'd also like to warmly welcome our presenters from the US, especially Ruby Moore and Jennifer Johnson, who will be leading the session. And just a couple of brief Zoom etiquette issues. So we'll be recording the session, so we'll have a record that will be able to go on the website and be shared with people. If you can try and stay on mute if you're not speaking, that would be good. Gallery view so you can see everybody. If you post any comments and questions in the chat, so Kathy will be keeping an eye on the chat, and we'll make sure we can come back to people's questions and comments at the end. And Kathy, if you can just wave for those that don't know you, I think probably everybody does, yeah. Kathy's got the very important job of monitoring the chat, but also keeping speakers on time. So she'll give people a 1-minute warning, she'll ask you to wrap up, and then she'll very politely, after 1 minute, say thank you very much, and then Ruby will then introduce the next speaker. We do plan to have 15 minutes at the end for questions, but we found in our first session that there was a lot of interest, a lot of material, so we are happy to stay another 15 minutes. Some may need to leave, but others, if you'd like to stay online, we can continue the chat on for that extra period of time as well. So now, great pleasure to welcome Ruby Moore to introduce our presenters and also the members of the US Advisory Committee for IIDL. It's an amazing dynamic network. US has only been a member for 1 year and already making a great impact on IIDL. So Ruby, to you and your presenters, warm welcome. Over to you.
Thank you, and good morning, good afternoon, and good evening to everyone who has joined us. We're really excited to have you here, and as the co-chairs of IIDL US, Jennifer Johnson and I are welcoming you to what promises to be a very rich conversation. We're basically in the next 2 hours going to cover about a half a century of work that's been done within a very complex American system that we call the Developmental Disabilities Network. Some of you are familiar with the work of that network and more broadly in the US, and some not so much. So we're looking forward to having this conversation to kind of level the playing field, begin with a shared understanding of the work that's happening through our Developmental Disabilities Network. This is a network that was intentionally designed to promote best practices, change law and policy, and to support people with disabilities to have good lives. So we're welcome to the conversation. We have a lot to cover, so I'm going to turn it over to my colleague and fellow advisory committee member, Dr. Tawar Good.
Good afternoon, good morning to everyone. I'm going to go ahead and get started. I'm Tawar Good, and I am the director of the Georgetown University Center for Excellence in Developmental Disabilities, and also the Georgetown University National Center for Cultural Competence. And my role today, next slide, please. Next slide, please. Thank you. My role today is to really give an overview of culture and values of the United States and what those implications are for disability leadership. Can you go back to the slide before this? Yes. So these are the 6 basic values of in the United States. Although there are many different values, these are the ones that came up most frequently when I did my search in preparation for this presentation. I'd like for you, as we go through, to really think about these values and looking at them within the context of the United States and what they may mean to people with disabilities. So individual freedom, equality of opportunity, self-reliance, hard work, competition, and the American dream. And we will explore each of those. And again, comments as it relates to individuals with disabilities. Next slide, please. So individual freedom. This is really the core of the United States. It's very founding. You see language about freedom in seminal documents for the U.S., including the Declaration of Independence, the U.S. Constitution, and also the Bill of Rights. I do urge you to think about this notion of freedom and how important freedom is, and that people with disabilities may not enjoy that freedom because many still remain confined in institutional settings. Next slide, please. Equality of opportunity. When we look at, again, this value of equality of opportunity from its very inception, the United States was founded on the principles of it being a welcoming nation. In fact, it has been described as a nation of immigrants. And just the fact of the population that came originally to the United States and added to the population of indigenous people who were already present, that this diversity by race, ethnicity, and culture continues to define the population of the United States. And because of that, in terms of equality of opportunity embedded in our Constitution, there's a prohibition by the 14th Amendment in terms of any kind of discrimination based on race, religion, gender, et cetera. And so that, again, this is embedded in the fabric, and it reinforces the value of equality of opportunity for all. Next slide, please. So if we, again, continue to look at these, of the 6 basic values, I lumped several together: self-reliance, hard work, and competition. And again, I encourage you to think about what do these values mean in the lives of people with disabilities in our country. So we know just, again, that independence is highly valued. There are people with disabilities who may have degrees of dependency. So let's think about what that means. Being dependent on others is often considered shameful or embarrassing. Self-reliance is a preferred norm. Hard work is expected and rewarded. And we can think about many people with disabilities who want to be employed and don't have that, have not had that experience. Failure or inability to work hard is frowned upon. We all have varying degrees of ability to be able to work. So again, thinking about this within the context of disability. And lastly, hard work underlines competition, which is a bedrock of success, again, in this society. And so that if you look at them, they're all really linked together. Next slide, please. This is the American dream, and as I shared yesterday, I learned a lot in terms of what does American dream mean. And many people have different images of what this dream means. Oftentimes you would see material things. Again, this notion of life, liberty, and the pursuit of happiness is embedded in the Constitution. So it's saying that all people are created equal, and that they have these capabilities. And I think what's particularly interesting is the pursuit of happiness. So it's not just free to live, et cetera, but it's basically saying you should live your best life. A second reference that I discovered in this was the work of James Adams. And I read some passages from his book, and it was published in 1931. And so I think this is very powerful. A dream of social order in which each man and woman shall be able to attain to the fullest stature of which they are innately capable and be recognized by others for what they are, regardless of fortuitous circumstances of birth or positions. This is a very different connotation in terms of the American dream. It's one that we still have to really live up to. Its promise has not yet been fulfilled. for all people here in the United States, in territories and tribal communities, and also people with disabilities. Next slide, please. It's important to know that we value the United States. I'm going to say we, the proverbial we, our capitalism and federalism, so that if we look at capitalism as this economic system that puts a lot of weight into corporations, private corporations and individuals, very little in state-owned wealth. Then as we look at federalism, we have a central government or federal government. However, many of the states, all of the states have their own rights. And so again, this power sharing is very unique to the United States. Next slide, please. We have some new values that have evolved over time, and specifically looking at people with disabilities, which include self-advocacy, self-determination, meaningful inclusion, independent living, productivity, person-centered, and culturally competent, which is actually defined in the DD Act of 2000. And so as we look at these values that have evolved, some of them are in direct contrast to some of the things that we saw in the large 6 values, and others are putting much more defined meaning on what it means in the lives of individuals with disabilities and their families. Next slide, please. So, in summary, if we think about these values, how do they apply in the United States? The population of people with disabilities have been slow to share and realize these benefits. They've had to fight for those in many, many different ways, and the fight continues. There's legislation that has been enacted at a national level. However, we know that people with disabilities continue to experience discrimination, marginalization, bias, and this really does inhibit their capacity to achieve the American dream as described earlier overall. We also know that equality of opportunity is further compromised by people who have disabilities and the whole notion of intersectionality. So that here's a group that just by virtue of disability may indeed be marginalized, but then when you add to it other groups and also other social identities, such as race, ethnicity, LGBTQ status, that further compromises equal opportunity due to discrimination and other biases. Next slide, please. I'm sharing with you a quote from Justin Dart, I think is very powerful, looking at the American Disabilities Act, which is landmark legislation here. And
I just need to give you that 1 minute time check.
Thank you. It was just about the same time before. ADA is a promise to be kept. And what is a promise? For whatever the law says legally, the clear promise of the ADA is that all people with disabilities will be fully equal, fully productive, and fully prosperous, and fully welcome participants in the mainstream. But keeping that promise is not going to be easy. I would say that is the work of disability leadership, is keeping the promise. Thank you.
Oh, thanks, Tawara. That was brilliant. I was just looking at you going, oh, that was great, and realized I have to say something now. Next, we have Dr. Amy Hewitt.
Thank you. My name is Amy Hewitt, and I'm the director of the Institute on Community Integration at the University of Minnesota, one of the programs in our DD network that you'll learn more about as we go through today's presentations. I've been asked in 10 minutes to give you an overview of the complex maze of services that we have in the United States. I will tell you up front, that's an impossible task. My slides have a lot of data on them. I'm not going to share the data with you. I'm just going to share the main point of the slide, but kept the data in so you have it for future reference. So next slide, please. I think one of the most important things to remember about our services and the systems through which we deliver services and supports for people with disabilities in the United States is that We're a nation of 50 states, and inside of those 50 states, we have a little over 3,000 counties and about 19,000 or more municipalities or cities. And each of those levels of organized areas in our country have certain amount of power related to how funding is disseminated and what services are offered. In all of our research at our institute, we've found over the last many decades that the single biggest predictor of outcomes for people with intellectual and developmental disabilities is the state in which they live and their zip code, and that rings true today. It's very uncommon for us in the United States to say, here's our program for disability services, and every state and local entity needs to deliver those services in exactly the same way. It just doesn't happen that way. So when I describe programs, they're run very differently. Next slide, please. Another really important contextual factor about our service system is that we don't have a national healthcare plan. And so we find ourselves in a situation where the overwhelming majority of services and supports to people with intellectual and developmental disabilities are funded through essentially three healthcare plans or programs that exist and are authorized by the federal government. I'm not going to give you all the details, they're in the bullets, but the three programs are Medicare, which was initially designed in 1965 for people who are over 65. And then in 1972, we added a component for people who have chronic long-term disabilities and receive Social Security disability income. Next slide, please. Another key program, and the one through which most of our long-term services and supports are funded, is called Medicaid, and it's a public assistance healthcare program. It's means tested, so it's designed primarily for people who have low income. It serves about just under 18% of the American population, and it targets low income adults, as I said, children, pregnant women, elderly adults, and people who are blind or disabled. It's through this program that we have constructed the primary funding mechanism for our services in disability. So they all come through that healthcare lens versus a social model of disability, which presents some limitations. Lastly, I would just share that many states have a children health insurance program. Next slide, please. That covers roughly just over 9.5 million children who are enrolled in this program. Next slide, please. Next slide. Within Medicaid, there's a program or a service that we call Medicaid Home and Community-Based Services. It's a highly flexible program. A Medicaid Home and Community-Based program in Minnesota looks very different than in the District of Columbia or Oregon or Florida or whatever state a person lives in. There are some requirements at the federal level that states have to follow when they decide they want to offer one of these home and community-based waiver programs in their state. In Minnesota, as an example, we have 6 different waiver programs. I included on this slide in that upper right-hand corner, just for Minnesota, the federal statutes and the Minnesota statutes that authorize this service and put forward requirements. It is by far the largest funding program for people with disabilities in the United States for community services, and is widely thought of as being the most flexible program. That could be debated by many people, but it exists and it serves a lot of people. Next slide. In the United States, we don't really think about special education as being really a part of what we would consider a long-term support and service. We tend to talk about it that way where I work, because for 13, 14, 15 years, depending on the state in which a child lives, it's providing the primary source of support services for children with disabilities. There are 13 educational there are 13 eligibility criteria based on 13 categories to be eligible for special education. And services that are delivered to children in special education are grounded in an individual education plan. So we have special education. The outcomes of special education you can see on the next slide for children with the most significant support needs. We're not doing a very good job in finding inclusive education opportunities for people. The overwhelming majority of students with the most significant cognitive disabilities in the United States are in more segregated pull-out type classroom situations. Next slide. A very important aspect of our service system in the United States has been this focus on deinstitutionalization. And so for the last 2.5, 3 decades, that's been a really primary push in our service system to close institutions and have people receiving supports mostly in the community and in their family or individual home. This chart just shows you that rapid movement. When you think about policy change and how quickly in the United States we've moved people out of institutions, moving since 1975 from a peak of just under 200,000 people living in institutions, and now we're under 20,000 individuals living in institutions. Next slide. The next slide just gives you an idea about how many places we've closed over that period of time by number. So this shows you kind of in each 5-year increment how many institutions we've actually closed. They no longer are open or exist. And it's, again, an indication of our commitment to community and individualized services. Next slide. We spend a lot of money on services in the United States. Our long-term services and supports is about a $70 billion investment. And what we've tried to do over time is move that investment more towards individualized supports and away from group home and group facility type supports. And that's the point of this slide, is just saying, let's put our money where our priorities are. And over time, you can see a change in that investment. Next slide.
Amy, I'm giving you that 1-minute time check.
About the same place, thanks. And if you look at employment services, this just gives you our trend. Over time, we're reasonably flatlined around integrated employment. We've shrunk facility-based work or sheltered work and increased non-work activities in terms of our programs and services. Can you skip 2 slides, please? When we think about expenditures for people with intellectual and developmental disabilities, to give you a range, we are spending anywhere from $12,000 if it's a child living in their family home to an average of $141,000 for people who are living in what we call an intermediate care facility or a group home. The last point I want to make is about outcomes. We have a program called the National Core Indicators. If you turn to the next slide, you can see that over time we're able to, in most states, not all, see how we're doing in terms of outcomes for people. So this is a scale that looks at choice of residents, roommates, work, day activity, and staff. Over time, the next slide is around the staffing and the stability of that staffing.
Thank you, Amy.
You're welcome. Thanks, everyone.
Thanks, Amy, and thanks also for including all those great data that can't be adequately described in 10 minutes. You were brilliant. And next we have our fearless leader, Dr. Jennifer Johnson. Unmute. You need to unmute, Jennifer.
Thank you. So I seem to always do that. And yes, hi, I'm Jennifer Johnson. And thank you for joining us today. We're really excited to have this opportunity to share with you information about what we think is a unique program. As mentioned, Jennifer Johnson, and I'm the Deputy Commissioner on Disabilities. On Disabilities, Department of Health Services. I want to thank TWAR and ACEs and supports and opportunities for people with intellectual and developmental disabilities in the U.S. As I mentioned, I'm going to be talking to you about what we call the DD network here in the U.S. and how they work to improve those systems and those services so that Americans with intellectual and developmental disabilities can also achieve the American dream. If you can go to the next slide, Amy had taken you through the data on people's living conditions over time, and what I'd like to start with is the pictures behind that data. The DD network that we're talking about with you today is significant because it is the only network of programs in the United States and its territories that is solely focused on the ID-DD population. That we all know is more vulnerable and at greater risk for abuse and neglect, which was pretty rapidly occurring here in the United States. And this network has really been a part of changing that those living circumstances. And if you can go to the next slide, so that people really have opportunities to live fuller lives in the community and really work towards achieving that American dream. We know that, again, if people with intellectual and developmental disabilities are hidden from society, then we don't know about them. But the DD programs really work to make people with intellectual and developmental disabilities not only visible, but actively participating in all aspects of community life. If you can go to the next slide. So specifically, the network that we're talking about, and actually go to the next slide, please, thank you. It is comprised of what we call state councils in 2000. However, what is important to note is I'm seeing the message that I'm breaking up. Can you all hear me now, or sorry about the
So Jennifer, I think you broke up a bit at the beginning and just a little bit now, but the middle bit was okay. So
okay.
I think we just keep on going and pray for the best.
All right, sorry for my connectivity issues. So I don't know what you were hearing when I was breaking up, but I was talking about the 3 programs that are authorized under the Developmental Disabilities Assistance and Bill of Rights Act. And what's important to note here is that it's not just about the programs, but it's really about the people that are not only behind the programs, but working alongside the programs. And so the programs really value the individuals with developmental disabilities and the family members that really are the focus of the work and the partners in the work that's being done. If you can go to the next slide, What's unique about this network of programs is its history within the disability movement in the US. For over 5 decades, these programs have been working to advance services and supports and opportunities for people with ID/DD. I think when we look back at any successful movement, we oftentimes see that there's a champion that has helped to propel movements forward. And in the case of the ID/DD population, that really goes back to the Kennedy family and the role they played in bringing to the forefront the ID population. They had a family member with intellectual disabilities, and they were told to put that family member in an institution, but they said, no, we want her to be a part of our family life. And so that was really a turning point where when the president, Kennedy was in his position as president, was able to appoint a panel on what was called mental retardation at the time to look into how do we really move people out of institutions and into the community. And from that panel came a number of recommendations, one of which was to establish what were called university affiliated facilities. Because there's a recognition of the need to be able to train individuals to be able to serve people in the community. And that in order to move people to the community, you needed to build that capacity. And so those original universities that were established, there were about 8 that were established back in the 1960s, are now part of what we call our University Centers for Excellence in Developmental Disabilities. If you can go to the next slide. And so over time, we've had the programs added to them. In 1970, the state councils on developmental disabilities were added because parents really came to the forefront and said that it was very important for their children's voices to be heard in policy conversations. So again, state councils were formed. And then in 1975, the protection and advocacy systems were established when there was a lot of work being done to expose the abuse and neglect that was going on in the institutional settings. And so Congress recognized the need to have a system that allowed people access to legal advocacy services to protect them. And then another program that has been authorized is what is called Projects of National Significance, which really allows us to address national issues in priorities to move forward on change. Go to the next slide. So today what we have in place is this national network of the DD programs, if you can move to the next slide. And again, at the center of these programs is individuals with intellectual and developmental disabilities and their family members. We have the state councils, and we have the state protection and advocacy systems and the university centers, and they work in unique ways. They each have their own mission. The state councils really focus on bringing groups together in the council membership and work on developing leaders and promoting self-advocacy and also testing and promoting innovation and also advancing policy. The state protection advocacy's specific role is related to legal advocacy, where they're monitoring and investigating cases or allegations of abuse and neglect. They also are providing legal representation, both to individuals and in the group cases, and then basically ensuring that people have equal access to the community. And then our university centers do what universities do. They train people, but they do it in an interdisciplinary way. So they're bringing multiple disciplines together. They also work on connecting research to practice so that we're advancing evidence-based practices. And they do a lot around community service. And so they have a real connection to the community. Even though we fund these 3 programs in each state and territory, and they have these unique roles, collectively they do work together as a network in each state and territory. And that collective impact really has a tremendous impact in the states and territories in terms of the kind of change they can make. And again, even though they all have their separate charge in what they do, collectively, they're all working on changing systems in the state to make them better, building community capacity, advocating, building leaders, and also addressing issues related to diversity.
Hi, Jennifer. This is the 1-minute time check.
Great, thanks. If you can go to the next slide. So for ACL, what it means for us is that we have if you can go to the next slide, we have a connection then to all the states and territories. And to the next slide, please. So that we can be in a role of national leadership for the ID-DD population. So we are seen within the federal government as the entity that can really speak for and address the needs of the ID-DD population. And through our projects of national significance, we are able to, working through our network of programs, identify what are these national needs and address those national priorities. Currently, we have investments in employment, cultural competency and diversity, supported decision-making, community monitoring, and health equity. We also invest in longitudinal studies, which is where that data that Amy was showing you comes from. And so we are able to look at trends over time, and that has really helped to move policy forward.
Thank you, Jennifer.
With that, I am ready to close it out and turn it back to Ruby. Thank you.
You're on mute, Ruby.
Hello, yes.
Thank
Hello.
you so much, Jennifer. Next, we're going forward, and we're going to come back to Dr. Amy Hewitt.
Thanks so much, Ruby. I've been asked to just share with you a little bit about the specific University Center on Excellence in Developmental Disabilities in which I work. And just to give you a context of what one center looks like, and I'll try to put that also in context with our network of 68 UCEDs. So our specific center, we're housed in the College of Education and Human Development at the University of Minnesota. We're a freestanding interdisciplinary institute with a direct report to the dean. Like many, but not all, UCEDs, we're 100% self-funded, meaning that we get a grant from the Administration on Community Living, where Jennifer works as a set of core funding, and then we're expected to leverage additional dollars so that we can expand our reach and the work we do. Our center has a good mix of federal and state dollars, so we do national work, but we also do quite a lot of work in our own state. All of our centers are required to have a life course lens, so to do work from birth to death, so to speak. And to give you an example, in our institute, we do quite a lot of work on early detection of intellectual and developmental disabilities, specifically in culturally and linguistically diverse communities in our state. And we also have a research study right now on inclusive retirement opportunities for people with disabilities. So it's a very wide spectrum of the kinds of projects that we do. Many UCEDs have a clinical component where they deliver services, clinical services. Ours does very little of that. We do quite a lot of telehealth to reach diverse communities and what we call greater Minnesota communities, rural communities. That's our clinical component. And many UCEDs do a lot of policy advocacy. Our UCED's much more focused on research and then the translation of that research for various stakeholder groups. So to give you just a quick overview of the kinds of research we do through centers within our UCED, we have a national center on educational assessment. So looking at when children with intellectual and developmental disabilities are in special ed programs, and we have standardized testing in schools that are mandated and required, how are these children being accommodated for those standardized tests? We do a lot of work in inclusive education and getting technical assistance and training out to school districts, because in many states in the United States, the school districts are where policy sits and where practices sit. The state departments of education in all states do not have authority over local school districts around special ed. It just depends on the state. We do quite a bit of work on community living, and have, as the data I showed, we track where people with intellectual and developmental disabilities live, but we also do research related to promising practices. So a couple of recent studies we've done that I think are important to inform community, we had a project called Putting Faith to Work, where we did interventions in faith communities around their employment ministries, and worked directly with the faith communities to help employ people, support people to get jobs instead of working through the disability provider, and the outcomes were much better. Very similar study we did around social inclusion, and we had much better outcomes when we were delivering the technical assistance and training to community organizations like service clubs, those kinds of things, where people had much longer, more genuine, lasting relationships. So those are the kinds of studies we do. We're well known for our work around the direct support workforce. That translates into training for us, which is another big area USEDs are required to do work in. So we do training for community and community stakeholders, and then we also have on-campus training for graduate students. One of our knowledge translation areas in which we do training is for the direct support workforce. We have an online training program called Direct Course. We have about 680,000 learners engaged in that system of learning every single day. And then we do a fair amount of training and technical assistance with organizations on how to find and recruit workers to support individuals with disabilities. So that's the training component. We also are required to do outreach, consultation, and technical assistance. We do that in lots of different ways. An example of our work in Minnesota is trying to get Minnesota to take all the ways in which they collect data related to outcomes and actually do something with it. So they have data from national core indicators, they have data from CAPS, all these different systems of outcome measurement, but they don't do very much with it. So we're working with them to try to figure that out, and trying to develop centers of excellence around the state. That's an example of kind of our technical assistance. We also do dissemination, which is really taking our knowledge that we've learned from our research, trying to translate that in ways that people can understand and use. We have a magazine we call Impact. It's electronic now, that many people look forward to getting that issue in this country and really around the world. We'll take an issue, let's just take, I don't know, I think the last issue was on self-determination. So what do we know about it? How are people using it? What's the policy? What's the history? And we try to wrap that into a meaningful issue. We have self-advocacy online, which is a way in which people with intellectual disabilities work with our researchers to translate what they're learning in their research into a Research for All section on that website that speaks to individuals with intellectual disabilities. And we also have a recurring publication for the workforce that supports people who support individuals with disabilities called Frontline Initiative. So I'm going to end with just a collaboration. One of the things we're expected to do, and you'll hear this from our P&A and DD Council partners, we're all supposed to work together. And a couple of examples that that come to my mind recently that we've done together. In the United States, we're a pretty litigious society, and we had a situation where we had this smaller institution. It was called MITO, and in that program there was a very disproportionate number of young African American males who were basically put in this institution instead of prison. And the techniques that were being used to support them were very prison-like and military-like. And they were getting hurt and abused. And so our P&A filed a lawsuit against the state over that. They won that lawsuit. Our DD Council then, they were working kind of to create the state systems, the infrastructure within the state, advocating for that around developing an Olmstead plan and an Olmstead cabinet. and a Olmsted Leadership Academy for self-advocates. And then our role has been these regional centers on excellence and doing technical assistance and training to scale up positive practices like positive behavior supports, workforce interventions, person-centered organizational change, systems change, those kinds of things. We also were asked from a research standpoint to follow up on the people who were involved, the individuals who were living at Mito, to follow up where they moved to in the community and how their lives were, and to write a report on that.
Amy, I need to give you that 1 minute time check.
Sure, I'm going to beat your 1 minute time check today. The last example I give is just we're all working together to try to figure out what's happening in our state related to COVID-19. And our role has been dissemination, knowledge translation. Our P&A developed a fact sheet around legal rights, and our DD Council is really working with the partners in policymaking graduates to get the word out to families and family members and parents about people's rights if their family member is diagnosed with COVID-19 and lands in the hospital. Thank you.
Eddie, I think you wanted to introduce a few people. You're on mute. Eddie, you're on mute.
Eddie, you're on mute.
There we go. Yeah, so Pavi, would you mind giving everybody a bit of a wave? So welcome to you. So Pavi's from the National Institute for Health and Welfare in Finland, Helsinki.
Yes.
Welcome
Yes,
to
hello.
you. And Ed Matler's from the National Mental Health Commission. He's off camera at the moment, but is he coming? Hey Ed, how are you? Welcome to you. So we've got 5 countries online at the moment, 6 including me. So it's pretty good. So, and well done everybody keeping on time. It's really fantastic. Thank you.
Thank you. So welcome everybody. And next we're going to hear from Dr. Beth Stalvey.
Hello, everyone. Thank you, Ruby. My name is Beth Stalvey, and I am the Executive Director for the State Council on Developmental Disabilities in the great state of Texas. As we have discussed, our entire network, but DD councils in particular, are really charged with pushing the system forward to fully include individuals with developmental disabilities to allow for living independently. We do this in a number of ways. We do this through policy work, specific projects, and also engaging individuals and families through leadership and advocacy activities. I'll tell you just a little bit about our council's structure. We are a 27-member governor-appointed council with 60% of our members who are individuals and family members. That means we are truly led by individuals with lived experience who have the majority vote on the activities that we work on in our state. The other members of our council are representatives from this network here, from our PNAs and from our university centers. We also have nonprofit and private providers and state agency representatives who provide direct services in our state. So our Medicaid program, our Health and Human Services, workforce and employment, our education systems, and our aging and older adult systems. So we have great conversations at our council meetings where individuals with disabilities will come and tell us, quite frankly, what is working and what is not working. And our providers and state agencies say either, well, that's not how it's supposed to work, or we need to go back and fix something. So it really makes for some good conversation. The governor appointment aspect of our council puts us in a very unique position for state-specific policy work. DD councils are the only entity sitting in state government that is solely focused on the strengths and needs and impact of government policies and practices on the inclusion of individuals with developmental disabilities across all sectors. We have many silos here in our country due to the way that our organizations and agencies are structured, our funding streams, and DD councils really serve to connect all of these systems through our membership, through our conversations, and through the convening that we do. The other aspect of our work is through our projects. We use relatively small budgets to try smaller scale but innovative programs and projects. We obtain data about what works and what doesn't work so that we can show our governments and partners how individuals with disabilities can be supported and the outcomes that can be achieved on a larger scale. I'll give you one example related to supported decision making. We, as a council, did a project several years ago to train a group of peer supporters, and the way the program was structured was essentially a hotline type structure where you would call in and get support from a peer on decisions that you might want to make in your life. Well, from a program standpoint, it did not work. But when we really started asking folks, it was that they did not want to call into a pool of people they didn't know. They wanted to select people that they trusted in their own lives to be their supporters. We were able to use that information with all of our partners and advocate for legislation that led to Texas being the first in the nation to actually pass supported decision-making laws. So yay. We're rarely the first in many things, but we're very proud of that. One other example I'll share is related to our university programs and colleges. We've had a program that was successful in providing on-campus support that would increase the number of individuals with developmental disabilities who graduate college. And now we are seeing a greater number of a new generation of young adults who have advanced degrees, which means in this country, they have a likelihood to receive greater employment opportunities and higher wages. We've done a couple of projects to promote training for individuals, families, and other sectors such as teachers on how to better identify complex mental health needs among individuals with IDD and to connect with appropriate resources. With this training and with some of this work, we can share with our education agency council member who can then share this project with all the teachers in our state. So those are just a couple of examples from my state, but there is similar action and activity among the other 56 councils in our country. My last example is really focused on self-advocacy. Because we truly believe in the individuals and families being the center of our work, we directly invest in individuals' ability to come to the table and be active participants and have a voice in our state policymaking process. So sometimes, as you can imagine, being engaged in the policymaking process does not come naturally to many people. And so our council provides training and skill building, not only to understand how the process works and all of those nuances, but also how to articulate their specific needs, barriers, and solutions with this unique audience. We do self-advocate training with young adults. We focus here in Texas on unique needs in rural areas. And we also do a great deal of advanced training, including fellowships, where an individual who is interested in disability policy can do a 2-year training program so that we can help build the next generation of disability policymakers. So those are just a few examples. Thank you very much for the opportunity to share the work of DD Councils with you today.
Thanks, Beth. That was spectacular. We're going to move forward here, and I'm going to say a few things about the protection and advocacy system. And first, I just want to say thank you to Jennifer because she covered a nice framework for sort of saying what the core functions of each of the Developmental Disability Network partners are. So I can shorten my presentation a bit. Anyway, well, as a protection advocacy system, our highest priorities are preventing preventable deaths and abuse and neglect. And so you can imagine recently, how busy we've been with the sort of rationing and potential discrimination and things that are going on. That's a whole nother, conversation. So I won't get into the weeds with that. We are a cross-disability program. We're part of the Developmental Disabilities Network, and we're a cross-disability program. So, for example, one of our largest systems reform cases now requires the state to not only build a competent community service and support systems for people with developmental disabilities, and to use best practices in transitioning people home from institutional settings, but it also requires the state to build a competent community-based mental health system that is based on evidence-based practices and more of a recovery orientation around stable housing and employment, for example. In this particular case, we're working with our DD network partners as well as our mental health amici in the case to help the United States Department of Justice and the federal court monitor to effectively work with us to move the system along in Georgia. So Jennifer talked about the range of remedies we have, so I'll just move along from there, but to say that our most effective cases are when we use all of those tools. Finally, I wanted to talk a little bit about the collective impact that Jennifer referenced, and then Beth did as well, and Amy, around the Developmental Disabilities Network in its intentional design requires collaboration among us. And we always kind of smile about that in our DD network because, you know, we're required to work together with people that we highly respect and really have a great affection for. We love working together. So I'll give one example of a collaborative project that we did to move things forward on a very critical issue in our state. Yesterday, I talked about the Children's Freedom Initiative that the DD Network worked together to bring home all of the institutionalized children of Georgia. Today, I'm going to talk about our Safe Schools Initiative. It started when a young man died in seclusion while he was at school. And so the PNA, as the PNA, we did the death investigation, but also looked at what were all the factors that led to this young man spending most of his school day, day after day, in seclusion. Then we ended up we worked with the DD network to say, we've got to kind of lift the veil on these practices that are harmful and dangerous, and then change policy and practice and regulation so that other youth don't die preventable deaths or miss the opportunity to go to school in a safe learning environment and actually learn. So the council and the PNA got together and we set up a set of public forums around the state so that we could engage school personnel, family members, people with disabilities, legislators, and other interested personnel to have difficult but important discussions about changing policy and practice so that we would have more humane and evidence-based practices for supporting children to go to school in a safe environment and a safe learning environment. And then one of our university centers for excellence has a very deep bench, as we like to say in baseball terminology, but they're very skilled at around the topic of positive behavioral supports. And so they worked with us and the state to develop curricula around creating safe and motivating learning environments to change the school atmosphere and culture so that children would be able to come to school and learn and be in harm's way. But not only the children, but also the school personnel and anyone who might be visiting the school. And that's something that's ongoing, but I'll just say that the immediate result is that we then have now one of the more progressive regulations and sets of policies around safe schools and the elimination of seclusion in the schools and the virtual elimination of restraint in the schools. And then that also inspired a whole nother body of work and a big case that we're now working on with the United States Department of Justice to, essentially it's a children's mental health case where we're trying to keep kids from being unnecessarily segregated, or there's a whole practice in the South here, at least in Georgia, of kind of pipelining high percentage of African American males into prison due to a lack of, effective children's mental health system and a lack of clarity about the ways to best support a more diverse population of kids effectively in school. So those are just two quick examples, but I really appreciate the opportunity to talk to you today about this. And moving forward, we now have two experts who are advisory committee. Well, Tia's an advisory committee member, and Michael's a friend of the advisory committee and IIDL, obviously. But we'll start with Tia Nellis, who's an internationally known self-advocate. And Tia, you can introduce yourself as well.
Hi, everybody. Thank you for the opportunity to come and talk with you today. My name is Tia Nellis, and I work for TASH, which is an advocacy organization which we focus on people with the most significant disabilities. And I'm here to talk to you today about all three of the DD networks, which I've been involved in. Some I've actually worked for, and then others I've also did some projects that they have funded and been a part of, and how all three of those are been very important to the self-advocacy movement. So I want to start with the protection and advocacy. So the protection and advocacy, we've been working together on a lot of different things that have been advocating for people with disabilities rights. And so a lot of people with disabilities didn't know what the protection and advocacy was. So we also found that it was important to work together so that we can teach each other about what we do and what we're all about. So part of doing that is we did a vote project that we are still doing. And it's a vote project that teaches people with disabilities around voting, doing vote training, why it's important to vote. We've gone around different states and did this in person. Now we are doing it online to different states, but it's a real partnership with the protection and advocacy and the self-advocacy organization. So it's a real partnership so that we work together and we do the training together so that we get to learn about each other, learn about what each other does besides the vote project. And it may give opportunities for us to work together in the future on other projects once we get to know each other and learn about what each other does, and to work and see how we can be a part of those things. Also, the P&A has, the Protection Act also has different groups. They have people with disabilities on their boards, their different councils that people with disabilities are a part of, and sharing their voices on there so that they can give information to the protection and advocacy about what could be works really well, what are some things that you can improve on, and then also how people can work together as a team, and also gives role models to other organizations to see that people with disabilities and people without disabilities can work together and train. The DD Council, also you heard, has many different projects. Many of my friends have been on DD Councils as a DD Council board member in all kinds of roles, which they have committees and they play different parts on those things and give their voice to other council members and give ideas of other projects that they would like to see the council to do that would help support people with disabilities, family members in the community. And then also they have Partners in Policy Making, which is a great opportunity for people with disabilities and family members to work together around policy and different projects, and learn about different systems that are what the council is about, what the USED is about, what different things that they're all about, and then do a project at the end, which also shares with other people around what they have been learning and what they have been doing and working together. That gives people with disabilities, again, and family members to work together instead of their parents are over there and people with disabilities are over there. It gives us to learn from each other and an opportunity to teach each other about, you know, because they mostly have young kids. So leaders who have been around the disability movement can talk to parents and talk about self-advocacy and give them the hope that their kids can be out there doing those things too in the community and speaking up for what they want. The last one I want to talk about is the Centers for Excellence, the USEDs. I had the opportunity to work at my USED in Illinois when I used to live in Illinois for 26 years as a self-advocacy specialist. And during that time, my job was to do training around self-advocacy, to do some policy work. And one of the other important things I did was something called LEND. And that is the Leadership, Educational, Neurological, and Other Developmental Disabilities. That's a mouthful to say. But it's an opportunity for people with disabilities to be a LEND trainee, to have also parents that are LEND trainees, to have doctors, that people studying to be doctors that are LEND trainees, educators, occupational therapy, physical therapy, but it's a chance for all of us to learn together and learn how to work with each other. It's 300 hours, which is a lot of time, but having that opportunity to work with each other. And one of the things that I found very interesting about LEND is when we talk about the medical stuff in disability, a lot of self-advocates don't learn about medical in their leadership training, about the medical part. And it's very important how to work with those medical professionals also about teaching them about disability, because sometimes all they get is books, and books are important, but it's really also important to hear the voice of the person and to hear the voice of the parents, so that they could help educate those professionals. And it's also important for us to learn those things when we're advocating and that kind of thing, how to speak up to your doctor, what are those things that are important for us, what is an evaluation, how you do, why do you do that? So that's an opportunity for that. And they also do research, and Amy and everybody else was talking about research, but it's very important to include people with disabilities also in the research. And we've been a part of many different things around research. I had the opportunity to do leadership, and we did research around leadership at the university. And I talked about doing leadership, and I did a leadership project, and I was really excited because I'd never been on a leadership project where I was actually running it. We did some research around leadership before that, and I held a leadership academy for a whole week where people with disabilities came together and learned about self-advocacy, learned about how to do a resume, learned about the 7 Habits of Highly Effective People, which is Stephen Covey, which is a leadership program for all kinds of leaders, not just people with disabilities, but all kinds of leaders. We have put it in a way that people with disabilities can understand it so that they can teach the 7 habits and go out there and practice it. One of the outcomes with learning about the 7 habits, an advocacy group in Ohio actually got their startup money for their self-advocacy organization by talking to their DD director and changing his mind about why it's important to fund people with disabilities. All 3 of these groups have funded self-advocacy in some way, their projects. Maybe they support their self-advocacy organizations and running their self-advocacy organization, operating that. Also, they have been participating, and it really works together when we all can work together as a team.
Yeah, can I give you that 1 minute time check, please?
Yes.
Thank you.
And so I think that if we all work together and learn from each other and learn what makes everything better and how we advocate together, and do that, and it will be a better place for all. So thank you very much.
Thank you, Tia.
Hey, so Ruby, I'll just jump in and just want to welcome David Nuttall from Department of Health and Social Care in England. Welcome, David.
Hi, sorry to be late.
Probably the end of a very busy day for you, so welcome to you. Hey, the presenters are going amazingly well for the program, so back to you, Ruby.
Thanks, Eddie, and welcome, David. So moving right along, someone that many of you know well, Dr. Michael Kendrick will be giving his perspective on the importance of this very intentionally designed developmental disabilities network in moving the ball on important issues for people with disabilities.
Welcome everyone today. I grew up outside of the US, in Europe and in Canada, but when I did move here, I ended up becoming the Assistant Commissioner for the state of Massachusetts. And that was quite an education, really, trying to figure out the American system. And it's a pity I never did, really, because it is so complex that it's quite baffling to visitors from other countries trying to work out how in the world America works, because we would like simple answers, and America's just not that simple. It's quite complicated. And it does some extraordinary things nonetheless in that complication. And I want to just highlight some of the role that the federal programs that we've been looking at today have been quite significant. First of all, that these programs have created a federal infrastructure to support leadership and development in the disability world across the country, and over a sustained period. We're looking really at a half a century of public investment in progress. And certainly there has been progress in almost every domain that these programs are involved with. However, it's been very uneven progress. And so there is a kind of desire, I think, in public service in many countries to have somewhat more uniform outcomes for everyday citizens. And that's particularly challenging in the US because everything is so much more complicated by having not just the federal government, but 50 plus states and territories. So we see then a great variance in terms of progress and outcomes. But what we do see is that there have been very real accomplishments. We won't have time today to get into it, but no matter whether you're looking at the US efforts at community inclusion or closing down segregated programs, replacing them with more individualized options in the community, for instance, employment, particularly inclusive employment, there's been very significant progress, and a lot of that is owed to the leadership that has developed. In this sense, the American experience has been one of really of investing in leadership development, and then bearing the benefits of that when that has been done. So these programs particularly are very notable because they provided a lot of the means by which that capacity has been developed, both at a national and at a state level. So if we had more time, we could look into more deeply how those investments have been made and why they've had the kind of outcome that they've had. And this leadership idea isn't really, in many places, people tend to think of leadership coming from professionals and experts and whatnot, and from governmental leaders. But these programs have operated on the assumption that leadership can come from many other sources, not just, of course, people with disabilities and their families, but people in the community at large, and other groups. For instance, there's a long investment in leadership from employers to hire people with disabilities, as a for instance. So the concept of leadership development as carried out by these programs is very nuanced, very complex, with many different kinds of leaders imagined and created deliberately so that we can impact on some of the outcomes on people's lives. It's also very important to recognize that this investment has translated into an awful lot of expertise of various kinds, that the opportunities to learn and master complex subject matter has been made available to large numbers of groups, not just through the USAID program, but also through the Protection and Advocacy Program and through the DD councils that we've been hearing about, and of course, more broadly from there. As I said, this has happened over 50 years, so this is a sustained effort at investing in emerging leadership. So it's quite an interesting story if we had time to get into all the detail of it. But just the very fact that they've stayed with it is very significant in terms of outcomes. However, I would say that it's very important to appreciate that the outcomes are very uneven. In this sense, you'll see a huge discrepancy from one state to another, and the challenges are quite different in one state to another. So while we have many leading edge states that have done many things that are very progressive in nature, we'd have states that are lagging behind. So in that sense, there isn't really a uniform impact of these programs. It's a non-uniform but real impact nonetheless. And the leadership is, many people tend to think of leadership in individual terms, specific leaders, but it's very important in this sense to see the idea of leadership in the collective leadership sense, the networks and the social movements that have joined forces with governments and with other groups to make a difference in how things affect the lives of people with disabilities and their families is very, very collective through networks and a lot of things that are just very informal in nature. So in this way, in some ways, the American performance informally is much better than the formal performance in many cases, because the informal leaders have made up an awful lot of ground that the formal leaders couldn't get their hands around because of the difficulties of being in those roles. What I would just like to draw attention to, though, is the amount of resources in this system. I'm not talking about financial resources, but the know-how, the expertise, the studies, the kind of products that are produced for various groups in the country is quite extensive. And they're constantly being updated. So if you wanted resources on almost any subject, you can probably find them. That's not to say that they can't be improved upon, but the very fact that these resources exist and are available to large numbers of people, it has been a very good investment in terms of what people have done with these kinds of resources. More recently, we've been working at, myself particularly, involved with supported decision-making, and there's been a huge investment in expanding the numbers of people that have access to supported decision-making and just to learn about it. And I think we'll see ourselves in another 5 years with a huge amount more to look at by way of resources and accomplishments. And that's only one stream of leadership, so you get a sense of how that system works.
Michael, can I give you a 1-minute time check, please?
The good thing to remember, though, is that if you're trying to figure out where all these resources are, good luck. You've got 50 different states, all kinds of groups doing this, that, and the other. In many ways, what you want to do is talk to some group like IIDL that knows the US well, because it can save you an enormous amount of time on Google. Because there's just resources that in some ways are better known by people that are close to them than they would be simply by trying to do research on the internet. So all I want to leave you with is that if you ever did find them, they'd be useful. And good luck with finding them. Thank you.
Thank you, Michael.
Well, looking forward to the future, and the challenges in front of us as a country, and even more globally, and within our developmental disabilities network. I just want to remind people that Kathy's been managing the chat room in terms of the questions, the resources, the comments, so that won't be lost if you didn't happen to be watching that and paying attention to presenters and whatever else you're having to worry about today. But as we go forward, there have been a number of both questions and resources offered around employment. And we know that that's a pillar of both recovery and a good life and economic security. So I'm going to ask Cecily Coulson to jump in here and say a few words about employment.
Well, hello, everyone. Thanks, Ruby. Yeah, I'll just a quick introduction. My name's Cecily Coulson, and I actually am the executive director of a nonprofit called the Washington Initiative for Supported Employment. I reside in Washington State, and I can probably attest to being one of those unique folks that gets to do fun, wild things out in the Pacific Northwest in the United States, where we stay away from. We like to stay on the west coast of the states. We're kind of like a community laboratory, and if we can figure out something, we try and tell everybody on the other side of the country so they can prove it for us and make sure that it's something that can come down in policy and be a new practice. So I kind of live in the Wild West, I guess, is like the culture that I come from. And the work that I get to do is on employment specifically. So our state has a culture of really emphasizing employment and quality services and outcomes for people with a range of disabilities, mental health, developmental disabilities. I work in the ID/DD sector in our state and have for the last 25 years. And our organization does training and technical assistance. So we build off what our USED is doing and the DD network is doing in our state. So I spend a lot of time on the implementation side of the work that we are doing. And we have about 7,000 people working in competitive integrated employment in our state. And that number is built over the course of over 3 decades now. So a lot of best practice experience where I come from. And we really are rabidly passionate about trying to pursue employment for every single person that wants to obtain that as part of their American dream. I like the way Tawara's framed that. So the last couple of days, it's really plays out well in terms of employment and what we do for our community-based services. In listening, this presentation really shows you the 3 lanes, I like to say, are like, they're like braided leadership services for all of us in the community. And we use those pillars in our state to try and leverage emerging leaders. We try and work specifically with employers and people with disabilities, try and bring those 2 needs together as best we can, meeting the needs of our employers and the needs of the person seeking employment. And also really look at starting as early as we can to also include the school system in what the work is that we're doing. So I'd like to think that employment is this great puzzle that you put together of all of the services and supports that our systems have. And the outcome really is something that is a community-based outcome, because you have employers who are not related to our system helping and meeting their own needs with people with really great offers in terms of employment skills. So I'll just kind of leave it there to give you the flavor of the work that I get. I'm so excited and inspired by getting to do employment work all the time. And there's so many interesting things coming up right now with technology and access. There's great opportunities. There's also great challenges for us coming forward to try and make sure that, again, that people with disabilities aren't left behind as our world is reshaping itself and reforming. With business changing, with technology, access, and information. And we've got a lot of work to do still, even though we've worked really hard for the last 3 decades to try and make the magic happen for everybody. There's still a tremendous amount of work to do. And this DD network is going to be something that we continue to work with and lean on as kind of that real bedrock of what we can do to try and include everybody. So happy to talk about employment for days. If anybody wants to reach out, and I'm looking for a discussion today too, but I'm very excited to be a part of this group as well.
Thanks,
I
Beth.
would add in terms of the employment piece, at ACL, we do have a strategic priority around what we call economic security, because to us, it's more than just getting a job. It's really about having a career. And so that's how we really are thinking about employment in the US right now at the national level. And what can we do as an agency to really promote the economic security through career development of individuals? There is a question in the chat box about entrepreneurship and how that's being supported. I don't know how well that is being supported, but that's something I think that is something that we see emerging here in the US. And again, is something that goes along with the ideas of career development, that to have a career, it may be somebody who wants to be an entrepreneur and pursue those things that they're interested in. And so we do have examples of our programs across the US supporting that, and some employment services working towards that as well. But a lot of times they focus more on just getting a person a job. So that's why we as an agency are focusing more on moving the conversation towards careers and economic security, and not just let's get a person a job.
Yeah, I'd just like to say to Clinton and other people who want to do a deeper dive on employment, there are a number of us, maybe all of us, but certainly Tia, Jennifer, Cecily, and I minimally, who this is one of the topics that we spend a lot of time on. The Administration on Community Living is currently funding a significant project around transition from school to work and careers, and that can include supports for people doing things that are more customized and entrepreneurial. We have a million examples of that, so that's a whole nother topic, and I know it's one that people are very keen on having an exchange at Christchurch about. So between now and then, I'd like to commit to convening some opportunities for us to formally or informally to have some of those conversations. Were you going to say something, Jennifer?
Yeah, I was wondering, Cecily, if you could pull up the slides again, because I think we were going to be pivoting to talk about the future and some of the issues that we're taking on. But the conversation that we're having, I think, lines up well for what we're talking about in terms of economic security. So if you can go to slide 20, Cecily. And while she's pulling that up, I'll just go ahead and start talking. What I'm asking her to pull up is this this model that I think we're currently in right now, and kind of goes back to what Tawara was talking about at the beginning of this presentation, where in the US, there's great value in being independent, but the way our system has developed over time, it really keeps people, if you have a disability, dependent upon the system. And there are many policies in place that make it hard for people to have careers and transition into life after school and have the services and supports that they need in order to lead a full life. And so what we're trying to do, if you could go to the next slide, is really move on from that cycle of dependency to one of a cycle of a self-sufficiency model, where people are really leading full lives and pursuing careers that they're fully included and meaningfully included in everyday life, and that they, again, are able to pursue careers of their choice, and that allows them to have housing of their choice, and that they're working towards more financial independence. So this, again, I think is just a representation of where we are and where we see ourselves going. And then if you go to the next slide, that takes us into some of the issues that we're dealing with in order to realize the self-sufficiency model. And I think you've heard about us talk about these challenges during the day today, or evening, depending on morning, depending on where you are. But one of those is just the infrastructure for home and community-based services, and the direct support workforce that is so critical to people living in the community. And I'll just go through these, and then I know we have folks on our advisory committee that are experts in these areas that can really speak to some of these issues. We're also trying to better understand how one lives well with a disability over their lifetime. As people are living older and living longer, what does healthy aging look like, and making sure we have the supports and the information to be able to do that. As more people are living in the community, what we're trying to better understand is how then do you monitor for abuse and neglect in the community, and what are some models for doing that, both using data as a way to understand community-based monitoring, but also looking at how we can use that data to then inform where we need to build capacity. We've talked about employment and youth transition, which continues to be an issue. And we're also doing work in the area of co-occurring conditions, both mental illness and disabilities. Because I think we've made such progress, we can now see where we face the greatest challenges in including people in the community and keeping them there in the community. And certainly people with mental illness and disabilities are the hardest to keep in the community, because we just really don't have the adequate services and supports for them to be able to live in the community. So we're doing more work in that area. And then you've heard us talk about supported decision-making and alternatives to guardianship, and work that we're doing there. And right now our work is focusing on what we call the school to guardianship pipeline. So youth who are getting ready to exit school oftentimes go into guardianship, and we find that that is often unnecessary for them to do, but then get stuck in guardianship as a result. We also will continue our work on self-advocacy, which is very important. Obviously, I think that message has come through today, in the development of people with lived experiences as leaders, and actively participating in system level discussions. So I know, like I said, we have experts on our advisory committee who can speak to these. And I know Isabel is certainly done a lot of work around supported decision-making. So I don't know if you want to say something now about that.
Unmute, Isabel.
Got it. Do we have a few minutes to cover this, or are we running short on time?
Go for it.
Okay, so I'm Isabel Hodge. I'm the Executive Director for the United States International Council on Disabilities, and I also serve as the Vice President of Disabled Peoples International North America and the Caribbean. So thank you for mentioning supported decision-making, Beth. Article 12 of the CRPD brought, I'm just going to say, instead of saying supported decision making, it'll make it easier just to say SDM. So Article 12 brought it to the forefront internationally, and it was really revolutionary. And although the US has not ratified the CRPD, because of the CRPD and national recognition, SDM is slowly taking hold in the US. Less than 20 US states and Washington, DC have introduced legislation or resolutions. Each state is implementing it differently. For example, in some states, they say SDM as a least restrictive alternative to guardianship should be ruled out before a court would order guardianship. In other states are conducting studies. There are very specific kind of SDM for medical decisions such as organ transplants. However, there is a movement towards formally recognizing in statute SDM and the role it has on the lives of people with disabilities. We're also seeing courts recognize SDM because in the US, you really don't need a law to change a state in your state to implement SDM. So additionally, we're also seeing some endorsements by national organizations such as the American Bar Association and the National Guardianship Association. And then from federal governments such as the US Department of Health and Human Services, Jennifer's department, and then the National Council on Disability. And the National Council on Disability in 2018 released a report that said there's really a lack of data on existing guardianships and newly filed guardianships. So we agree that collection of data around guardianship and supported decision-making is important, as well as funding for public services around SDM is also equally important. It's a lot more cost-effective to go the SDM route than to do guardianship route. For guardianship, it can cost between $5,000 and $10,000 because you're paying for the family pays for their own attorney and then pays for the individual with a disability, pays for the guardian ad litem. So it's a very expensive process. There's also, recognition that individuals subject to guardianship might not have the means or the know-how to file a petition to have their rights restored. And 20 state statutes, and we also have an amended act permitting informal requests such as handwritten notes or verbal requests by an individual asking to have their rights restored. So we're making some slow progress in this regard in the US, but if you would like more resources, you can visit the National Center for Supported Decision Making and the URL is supporteddecisionmaking.org. Thank you.
Thanks, Isabel. You did that very efficiently. We covered a lot of ground. So it looks like we have some time for questions and answers. And Eddie, do you want to facilitate that for us?
Yeah, sure. Yep, that's fantastic. We're perfectly on time, so this is excellent. Hey, just to flag, there's one question coming out of the chat, so I'm going to go to Clinton first, and then after that, Charlie, I want to reward you for being the first one on the Zoom call. So after Clinton's question, I want to come to you and get a comment and perhaps some questions as well. So Clinton, do you want to pick up on? There were a couple of threads in the chat line. One was around the portability issue, and the second I think was around peer workers as sort of job coaches. So would you like to pick up on either of those two questions? You probably need to come off mute, please, Clinton.
Sorry about that. Thank you for bringing me in. My question really was around how people, especially disabled people in the US, can move around and be included in the life of that other people take for granted. So my interest is in what programs are there to support portability of disabled people's aspirations and dreams to be part of community life, especially with the principles that you opened up with about the American dream.
Yep, so would somebody like to have a first go at answering that? Thanks, Clinton.
Tawara, do you want to take that you started to answer it in the chat box. If you don't, someone else can, but you offered some helpful advice.
I think that a lot of this is, I'm going to say culturally defined, and that it will look different in different communities and different states. So as we think about this whole concept of independence, which is a clear value in the United States, there are many cultural communities in the United States with members who have disabilities who strongly believe in interdependence. And so that when I was referring earlier that some of the values match nicely, some of them do not. And so what does interdependence mean? So if we look at some of the values that I articulated in face value, it would say that everybody's independent, that you don't have to rely on anybody else, that you should really, really work hard, and that is your self-worth. So those are a set of messages. I don't know that they apply always to how people view and experience disability in the US. So for some communities, people have never been institutionalized, that they've always been within their communities and well embraced and accepted. And in some communities, that is not the case. So I know I'm kind of all over the map with this, but that's the way our US system and also experience of disability is. It varies significantly.
So this is Isabel. I can share some personal experience regarding portability. We were a military family for over 20 years and moved across several states. So every time we moved to a new state, when my son needed services, we had to rely on the Medicaid waiver. And we had to get to the bottom of the list every single time we moved. So it wasn't until we actually retired from the military and stayed in a state for, I think it took us 9 years, on the waiting list as a priority family to receive the Medicaid waiver. Now, had my son gone to college, if he wanted to go to college in another state, he would have had challenges with getting the supports he needed from that particular state. We've seen cases where families have actually gone to this state legislator to ask for reciprocity between the two states for the Medicaid waiver. In some cases it works. In some cases, you know, it takes a long time for it to go through, and, you know, by the time it does, you know, a whole semester has gone by or more. So there's a lot of challenges with portability of services when moving, you know, across the states. I hope that answered your question.
Thanks Isabel.
Yes, it has, and thank you for being open and honest. Eddie, I had a second question, and my second question was really about the employment element of your talk. About how do you use disabled people to help and be role models, like for coaching and coaching other disabled people, like disabled peers, coaching and helping disabled people in the employment field, or being entrepreneurs.
Great. Ceci, you're going to answer that one, do you think?
Okay, sorry about that. Two mutes going here. A couple of things it comes to mind, and I'll put a resource in the chat box in a minute. I was just looking for it about, at least from a policy perspective, our microenterprise self-employment policy from our state. So I'll drop that in a minute. But to answer your question, Quentin, two things that are happening right now, at least where I'm from, is that we're being very specific about working with service recipients employment service recipients to become trainers in our network right now on just the needs of receiving a quality service and what that means to people with disabilities. So we're building out a whole line of training right now that we'll be launching over the next several months to have new employment professionals understand what the customer needs are. And some of that will be around self-employment, which is, I think, has been said a couple different ways here, is that we don't have a massive amount of cases for entrepreneurial sorts of adventures. We probably have 20 or 25 good cases in the state that I'm in, a range of businesses and examples of needs and supports. And what I think, while there hasn't been specific work done to do a peer-to-peer sorts of coaching, there's been intention around bringing people together to talk about their businesses and what they're doing with those as business leaders and entrepreneurs. There's also been a lot of commingling of our communities at the local level to try and promote businesses in general, including businesses owned and operated by people with disabilities. So whenever we can, we try and make that as typical as possible from a business perspective. But again, I wish I could say we had hundreds or thousands of cases. It's a pretty small amount, yet the stories are pretty rich.
Okay.
Just to add to what Seth was saying, I think peer-to-peer is a model that we've seen and used a lot in mental health. And we also fund another disability program called Centers for Independent Living. And they tended to serve people with physical disabilities more often than people with other types of disabilities, but they have oftentimes used that peer-to-peer model as well. And we're starting to see that model being applied to employment services for people with intellectual and developmental disabilities. So as Seth was saying, it's not used as much, but we're starting to see its application.
And I'll add to that quickly too. Our Federal Office of Disability Employment Policy under the U.S. Department of Labor has been promoting what we call customized employment, which essentially says customizing the relationship between an employee, in this case a person with a disability, and what their gifts and talents and contributions can be, and the unmet need of the employer. So to sort of take that beyond the notion of, are you seen as ready or so forth? And so within that framework of customized employment, a lot of work has been happening at the local, state, and federal level around saying what are reasonable kinds of measures for employment, careers, economic security, and in this case, if it's self-employment, how do you measure that effectively and still take on issues like sub-minimum wage and benefits and so forth? I'll just say as a P&A director, one of the things that happens in some of the DD network partner agencies is that we have made an intentional commitment to recruiting people with disabilities at every level of the organization. And so one way that we build community around a particular topic like advancing employment is for people to see as an employer that we're not just giving instruction on how other employers might go about it, but what kind of employer are we? And people with disabilities and other employers as well then see that you're walking the walk and that you are figuring out what are reasonable accommodations, what are performance enhancements, how do you create a high-performing work environment without excluding people who have a significant impact of their disability. That turns out to be the most fun part of this job, I'm just going to say. And then some of us have, I know our P&A, for example, we incubate things that need to exist in our state. And it isn't always us. Sometimes it's the USAID, sometimes it's the DD Council, sometimes it's all of us all together. But we, for example, one of the things that we incubated in the state of Georgia was the Georgia Micro Board Association, so that people who didn't want to pick traditional employers, it wasn't what they wanted something way more individualized or imaginative or just a better fit, had an opportunity to not only cultivate essentially a provider organization where the chair of the board and the CEO is the person with the disability. And then the people who are supporting that person, if it's around employment, you know, our employers, our business leaders, are people who know the person and want to advance their employment. So there's a lot of really fun, cool ways that we've been moving the ball for entrepreneurs, including incubating organizations that provide sort of a business support model for entrepreneurs who have developmental and other disabilities, who have all kinds of ways of expressing their art or their talents that have been yet undiscovered. And then through the Division of Vocational Rehabilitation under the Department of Education, they, sometimes better than others, have paid for people to start their own businesses and entrepreneurial ventures with support.
Hi, Ruby and Eddie. I was just going to say we have about 5 minutes left.
Yeah. And so Ruby, I think you said before, you've got a standing invitation now that people who are interested in employment will start to create an opportunity for people to connect around that. So just mindful now. So I just want to go to Charlie for a, Charlie's still here. Everyone's moved around the screen. Oh, Charlie's still there, right in the middle. So just a comment or a question, Charlie.
Listen, Eddie, I just wanted to say thank you to all the presenters. It's such a rich experience, this. I've taken so many notes. It's just incredible. I had the pleasure of working with Tawara and others in Washington last year, so being able to build on that knowledge base has been fantastic. Jennifer, I was really struck in terms of the similarities. Our infrastructure is so different in Scotland, but the similarities of people's experience, I think, at the moment is really, really telling. And as we're preparing the regeneration and the rebuild agenda in Scotland, moving on from the pandemic, we're really interested to hear more about the self-sufficiency investment model. And Tia, on a personal level, we're moving forward. I came back from Washington really inspired, moving forward with a leadership program for people who have learning disabilities in Scotland. And I'd be really keen to know if you've got any follow-up information on the impact of your Leadership Academy. But fantastic evening. Thank you so much.
Great. So thanks, Charlie. So perhaps I might just float with people now. Sort of what happened in the earlier session yesterday evening was there was so much material, so much energy, so much interest that even saying we're going to go for another 10 or 15 minutes was just an opportunity for one more question, let alone all the questions that people would like to ask. So we did think about maybe offering people another follow-up session where those who were interested to connect again and go layer deeper. Now, of course, we are going to, we've recorded this, so it'll go on our website. We've got the presentation packs, all the slides, all the contact details, but I think there is something about the fact that we've now made personal contact. You know who people are, and it's an opportunity to go directly to people to find your way through the masses of information that's available. So I think I'll probably make the call that rather than try and build in another one or two questions, we might just say we'll create another opportunity. Anything that's on the chat line we haven't got to, we will get to. Everybody's got a personal contact now, so if you've got a question and you know a face, you'll have the email address and you can do that. So what I might then do is just try and wind it up a little bit. Now, Jennifer, did you want to? I think in the first session you did put out a bit of an invitation for collaboration from our other sort of fellow members, both from IIDL and IIMHL. So would you like to sort of say a few words on that?
Sure, happy to. And I think we're going to be sharing the PowerPoint presentation that we've been showing throughout today's session. And at the end of that is links to information about the national organizations for each of the programs we've talked about today. So you can go on the websites for those organizations so that you can see the programs and where they are in each state and territory. So at least you have contact information for them and a little bit of information about the organizations that support each of the programs. One of the things that I think came out in this session and Michael talked about is that there is a very vast amount of work being done within this network of programs and very deep work that is being done as well. So Seth is showing the slide here that provides you the links to the national associations for each of the programs. I think it is hard to know. We can certainly provide you links and you can go and look at these websites. But I think if you have specific questions or specific areas of work that you're interested in, we're certainly happy to help facilitate those connections for you all so that we can lead you to the right folks. Because again, there is just a real vast amount of information and resources within this network of programs.
Thanks, Jennifer. And perhaps before I sort of just wind it up, I just wanted to say Ruby and Jennifer in particular for getting your network together and with Michael also assisting with pulling this together to have put on such a spectacularly good, wonderful set of presentations. So the depth and the richness and the generosity of people's contributions has been really outstanding. I'm not going to try and summarise any of the content, but I do want to finish with one of Michael's sort of comments about the know-how, the resources, the expertise. And we've got an advisory committee here who are amazing people with amazing connections. And I just really want to encourage people to, sure, get on the websites and have a look, but also use members of the advisory committee to find your way through and to develop that relationship. And so we will come back with an offer of another more informal session where people that want to pursue particular issues can, we can drill a lot deeper because I think there's a lot of richness there. I think employment is one issue. I've had quite a few comments on the chat line that people are very, very interested in. So we will scope something as a follow-up. But on that note, Ruby, do you want to have last words?
All I really want to say is thank you, and we appreciate you all so much. You've gotten a glimpse into a fairly complex U.S. system that we're all a part of, and we respect that each of you in your work, in your worlds, are also doing significant work. So we're very keen on connecting with you around some of these universal issues facing people with disabilities and promoting the imagination and innovation that I know we're all capable of. Looking forward to getting to know you better, and thank you.
And Ruby, I just also want to acknowledge our IIMHL colleagues, and I didn't have a chance to bring you in, but there were a lot of themes around, you know, segregation and protection and employment and a lot of things that cut right across disability and mental health. And so, so I've been very encouraged. We had a number of mental health people in the first session as well, who were very, very engaged and interested. And so I'm very, very keen on this sort of an environment where we can bring people from both streams together and share sort of common issues as well. So on that note, a huge thank you to all our presenters again and everybody else that contributed to our call. Thank you all very much.
Thank you.
Thank you.
Thank you.